Hello and welcome. I want to thank everyone for beginning to join us this afternoon. So hello, my name is Christina Kaminsky and I'm with Sexual Assault Services of Saskatchewan. And first, to start off our afternoon session in a good way, I'd like to acknowledge that SAS is located on Treaty 4 territory, and we are also a provincial organization, and we aim to serve all of the territories that comprise Saskatchewan. And for SAS and those of us who are settlers and guests on this land, we seek to work in collaboration with the Métis Nation and all First Nations communities to address sexual violence. We truly believe that there can be no real systemic change that is not centered in decolonizing principles and reconciliation. Sexual Assault Services of Saskatchewan is a provincial nonprofit organization that seeks to raise awareness on issues and collaborate collectively with frontline agencies, community partners, and governments that provide support and advocacy for those affected by sexual violence. And so Sexual Violence Awareness Week, this entire week that we're having, is created in order to raise public awareness on issues relating to sexual violence in Saskatchewan through educational events, resource sharing, and change-making conversations, such as this conversation we're about to have this afternoon. Every year, SAS launches a provincial awareness campaign through collaborative efforts with our member agencies and our other provincial and national partners. The campaign changes from year to year in order to shine a light on the various and complex forms of sexual violence that exist within the continuum of violence. This year, our sexual violence campaign focuses on issues of human trafficking and sexual exploitation. Human trafficking and sexual exploitation are not new issues that impact individuals within our province, but there is a significant gap when it comes to understanding, addressing, and responding to the issue of sexual exploitation and human trafficking. All week, we'll be sharing an overarching message that people are sexually exploited and trafficked by their intimate partner and by people in their lives every day. And we want to do this in order to raise awareness that, like most forms of sexual violence, sexual exploitation and human trafficking occurs between two individuals who have been or are acquainted with one another. So we hope that you stay with us throughout the week for our full slate of activities and events, and you can register for the other free event that's happening on Friday that's regarding ambiguous loss for folks who have lost individuals to be missing or due to trafficking and exploitation. And you can visit our website to register for that free event or join it in progress at www.sbaw2022.ca. So thank you for being with us today, and I'm pleased to introduce our next speaker, Ashley Franson Tingley. So Ashley works at the Canadian Centre to End Human Trafficking, or the Centre, and the Canadian Centre to End Human Trafficking is a national charity that's dedicated to ending human trafficking in Canada and be the operator of the Canadian Human Trafficking Hotline. And in her role as the Centre's Director of Stakeholder Relations, Ashley works to enhance cross-sectoral collaboration by developing strategic anti-trafficking partnerships with frontline and delivery partners, survivor leaders, governments, anti-trafficking advocates, police, and private sector companies. Ashley works with a dedicated team to leverage collective knowledge and expertise from the anti-trafficking field to inform the Centre's advocacy efforts, its external partnerships, strategic engagement activities, and its regular hotline operations. So with that, I'd like to thank Ashley for joining us today and let her take it away.
Thank you so much, Christina, for that introduction, and good afternoon, everyone. First, I just want to thank the Sexual Assault Services of Saskatchewan for inviting the Centre to participate and be part of this really important conversation about human trafficking during Sexual Violence Awareness Week in the province. And really just want to thank you all for sharing some of your time today. I know everyone's busy, but really appreciate you joining us today. So like Christina said, I am the Director of Stakeholder Relations at the Canadian Centre to End Human Trafficking. So I'll be leading you through today's conversation. I'm briefly going to share about the Canadian Centre to End Human Trafficking, so who we are and what we do. And then I'm going to talk a little bit about some of the trends and the research that the Centre has presented over the last year. And then I'm going to move into a little bit more about the hotline and its role and function. But I just really wanted to quickly note before we begin that I'm going to use the words today, victim and survivor, throughout my presentation, but I do want to acknowledge that those terms mean different things to different people. So for the purpose of today's conversation, a victim will refer to someone who is still in an exploitative situation, but who is someone who is surviving every day, whereas the phrase survivor is used to identify an individual who has left an exploitative situation. So a little bit about us. We're a national charity. We're focused on ending all forms of trafficking in Canada. And we were founded in 2015 as a response to the recommendations that came out of the National Task Force on Sex Trafficking of Women and Girls in Canada. And like Christina mentioned, we are the operators of the Canadian Human Trafficking Hotline, which I will go into a little bit more detail later. But we really seek to function as this backbone organization, and we do that by supporting cross-sectoral collaboration, by sharing information and best practices, by bringing stakeholders together, and really focus on trying to reduce those duplicate efforts that are happening, and really work to connect people so that we're dismantling the siloed approach that we're seeing to addressing the issue in Canada. The center is both publicly and privately funded, and we operate the hotline with generous support from the Federal Department of Public Safety, as well as other generous donors. So we also conduct primary research and data collection to shine a light on the issue of human trafficking. We also do lots of education and awareness activities. So we work with communities and networks and service providers, allies, private businesses, etc., to talk about the reality of this issue and to share the hotline resource. And we also we work with policymakers to address those systemic issues and advocate for resource allocation, share those best practices, and really push for sustained funding for frontline services so that we can bring forward lasting change. Very quickly, there are a number of challenges that we are hoping to address systemically and nationally when we're looking at the issue of trafficking, and there are a number of them here, but some of the major ones we're looking at is fragmented efforts, there's a lack of training, there's institutional racism and colonialism baked into many of our institutions, poor coordination of services on the ground, nationally, provincially, and we're really working to, it's sort of an uphill battle in terms of general awareness of this crime and really working to educate Canadians on what trafficking looks like and to move the needle forward on that. I also wanted to just quickly talk about what trafficking policy looks like in Saskatchewan, just as we're talking about this from a provincial perspective. So the province of Saskatchewan does have an anti-human trafficking working group. So that's an interdepartmental provincial group. But currently there's no integrated collaborative funded anti-trafficking strategy to support survivors of this crime in the province. And we have seen some promising movement. So there recently was adopted, and actually I think it just came into force, was the Protection from Human Trafficking Act. So those provide human trafficking specific protection orders as well as civil torts. And then we also recognize that there is a significant investment to policing through the Saskatchewan Trafficking Response Team. And again, with a significant budget attached, but we always like to see more of a balanced approach when we're addressing trafficking. So we would like to see more of a balanced approach to providing support for police services, but also community-based responses as well. And then in terms of what the lay of the land or the service landscape looks like in the province, we noticed that services are concentrated in cities or hubs, and there is definitely a focus on sex trafficking, and that's not unique to Saskatchewan. We see that actually play out across the country. But something that is a little bit more unique is that we are seeing a lack of services for male survivors of trafficking and few options for labor trafficking survivors in the province. So definitely some great work and momentum, but also opportunity to grow.
That's awesome. Sorry,
So
Ashley, I didn't,
yes.
we can't see your PowerPoint presentation.
Oh, really? Okay.
So
that's
if you just want to restart your screen, but that was a lovely introduction and segue. I don't mean to
okay.
interrupt and throw off your groove.
Oh no. Okay, let me see here.
just because I know the visuals were very spot on for our attendees.
Okay, there we go. Sorry about that. All right, we're just gonna have.
Perfect.
Okay, how's that?
That is excellent. Thank you.
Okay. Okay, all
And we're
right.
on your legislation piece. Awesome.
Perfect. Moving right along. So how are we responding to some of these challenges at the center? So I mentioned we're working with provincial and federal governments to inform legislation. We're hosting focus groups and primary research with migrant workers. We're doing targeted awareness campaigns on social media for both sex and labor trafficking. We do training engagement with stakeholders in the hospitality and transportation sectors. And we're also working alongside the hotlines in US and Mexico to see if there are any shared learnings and trends that we can share across the 3 sister hotlines. So really quickly, historically, our national understanding of human trafficking has typically been based on data collected by the Uniform Crime Reporting Survey, which is submitted by police services across Canada to Statistics Canada. And relying on this type of data to quantify the scope of trafficking can be really problematic. And like other crimes like sexual assault, we know that there's a very low self-report rate among survivors. So that means that for a whole host of reasons, survivors elect most often not to engage in the formal criminal justice process. And so then those folks are actually missing from those official quote unquote case counts. So this is especially true for individuals from historically marginalized populations. And while the data at the national level is imperfect, it does have some important findings and takeaways. So first and foremost, victims are trafficked typically by someone they know. Christina mentioned that off the top. Men between the ages of 18 and 34 make up 2/3 of the people who are accused of this offense. Although women did represent 17% of traffickers. And I should say this StatsCan data is definitely heavily skewed towards sex trafficking. Number 3, the vast majority, 89% of human trafficking charges are stayed, withdrawn, dismissed, or discharged. And that sex trafficking really is a gender-based crime, and it's overwhelmingly impacting female identified persons. So if you look there at the bottom, year 1, so that's May 2019 to May 2020, there were 2,390 substantive signals. So that includes hotline calls, emails, chats, and forms. Which identified a total of 415 human trafficking cases. So I'll get in a little bit more to the data in just a moment. But really quickly, again, so why is it so difficult to identify this crime? So we know that victims may be trauma bonded with their trafficker. They may be in an intimate relationship with their trafficker. There may be a familial relationship there. And that relationship might actually be the only stable relationship someone's had in their lives or is having currently in their life. We know that traffickers will lie and manipulate victims into believing that they'll get in trouble if they come forward. And there's a real fear of the unknown of what happens once they do come forward. Victims are often physically, but more often psychologically controlled, and so they don't seek help. And they're trained by traffickers to lie and give rehearsed answers to family, to support workers, to police. And what we're seeing is that oftentimes victims actually don't even recognize what's happening to them is a crime, and they certainly aren't identifying as being trafficked. Victims are also being moved from place to place, and so they either don't know where to get help or how to get help. And then again, distrust of police, service providers, and child protection agencies, especially for communities of color who have historically had negative interactions with these institutions, are less likely to come forward and self-identify. And some of those pieces also kind of bleed into the challenges that we have around research on this issue. So first and foremost, trafficking is clandestine in nature. It's difficult to identify. Victims don't self-identify. And then there are safety concerns for survivors and their families for being part of this research or self-identifying. Many organizations have a duty to report and that means that minors may be accessing services without disclosing their experiences. There's still significant stigma that's being faced by survivors when they're exiting from social service providers, justice professionals, and the community as well. And really, there's still a different understanding and definitions used to identify trafficking. So we see that the Palermo Protocol definition of trafficking, which has a more expansive definition of trafficking, is used by some organizations, and then others are using a more narrow definition, which can create a challenge there. And then, of course, there's biases within our existing data sets, which often exclude certain populations. Some of the current research that we're doing at the center to address some of these gaps is we're doing primary research. So it's an Indigenous community study. And it's still in the early stages, but we're working alongside an advisory group of Indigenous partners and survivors to develop an ethical framework to guide our research with Indigenous communities. We've recently just wrapped up our second migrant worker focus group in partnership with FCJ Refugee Center. So we look forward to presenting a public report of those findings later this summer. And then we're currently looking at the feasibility and the use of digital evidence in the justice system as a way to reduce the over-reliance on witness testimony. And so far, we've held a key stakeholder roundtable discussion about the practical, legal, and ethical questions around utilizing this type of evidence going forward. And before I move on, I think it's really important to acknowledge that trafficking does not impact everyone equally. We know intuitively that traffickers target those who have been historically marginalized. And evidence has found that these victims are disproportionately more likely to come from Indigenous, Black, 2S, LGBTQI+, and migrant communities. And yet this is really not that well understood in the Canadian context. And in addition to experiencing higher rates of personal trauma, these groups face broader systemic issues such as colonialism, anti-Black racism, transphobia, xenophobia. And that's really helped foster a distrust of our institutions. And that means that within this context, they may be more hesitant to seek help for fear of being re-victimized by those institutions. And like I mentioned earlier, this reluctance has led to a situation where marginalized communities are somewhat invisible in some of these data sets that are guiding policy-making decisions. And, you know, the reality is that unless we're really able to quote unquote see trafficking, it makes it very difficult to get rid of the issue. And also we're seeing an absence of data representing Indigenous, Black, and 2S LGBTQI+ and migrant communities. And it's really been hard then to understand the prevalence of trafficking amongst these groups. What are the root causes that make people more susceptible to being targeted for trafficking? And then what are those best ways to support survivors and stop perpetrators? So definitely lots of work to do around inclusion there as well. So just wanted to say that Indigenous females make up 4% of the Canadian population, but you'll likely know that they're extremely overrepresented amongst trafficking numbers, overrepresented in the sex industry. And this is particularly true in survival sex situations, which are highly visible, it's low paid, it's often street-based, and can be more violent. And there are obviously social factors that are increasing the exploitation amongst Indigenous identified females. Those include the legacy of residential schools, racism, urban migration, poverty, and involvement in the child welfare system as well. And research from the US has suggests that Black women and girls are overrepresented amongst sexually exploited youth. And 13% of youth in the US are Black, but they constitute 51% of all prostitution-related arrests for youth under the age of 18. So that while these are US statistics, there is certainly anti-Black racism that is well documented here in Canada. A 2017 study by the UN found that many of Canada's core institutions are still and continue to be impacted by structural racism. Members of sexual and gender minorities experience higher rates of sexualized violence and economic disenfranchisement compared to heterosexual and cisgender Canadians. Homeless youth are among one of the most at-risk groups for being targeted for trafficking. An estimated 35 to 40,000 youth experience some form of homelessness in Canada each year. 57.8% of homeless youth reported some involvement in child welfare. So again, that's a risk factor. And then there was a Loyola study that looked at youth in Canada in the US and found that 1 in 5 homeless youth that they connected with reported some form of exploitation during their homelessness. So certainly that intersectionality there between homelessness and being a member of a gender minority is a risk factor. And then really just wanted to mention temporary foreign workers as well, because we do see an intersection here between sex and labor trafficking when we're looking at hotline data. But again, temporary foreign workers typically lack the legal protections that most Canadians enjoy. Closed work permits and lack of pathway to permanent residency is a systemic issue. And then again, abuse and mistreatment are not uncommon experiences for migrant workers here in Canada. So with the generous support of Public Safety Canada, the Centre launched the Human Trafficking Hotline in 2019. And the focus of the hotline is primarily, first and foremost, to connect those who are impacted by human trafficking with local trauma-informed supports wherever they are in Canada. But the trend level data that we released in our year 1 report was gathered from that first year of data, which is anonymized, it's aggregated. And it allowed us to kind of look at the sort of the key learnings there. And so we identified 6 key trends that we were able to pull out of that first year of data, and I'll go into those a little bit more. But off the top, I mentioned this earlier, we had identified 415 unique cases of human trafficking, of which there were 593 victims and survivors associated with those cases. I think what's important here to pull out is that just 7% of trafficking cases were referred onto police. And I'll touch on some of the nuance a little bit later around reporting to police. But I do want to mention that there are sort of 3 times where cases would be referred onto police. First and foremost, when a victim or survivor provides consent, we can connect them directly to police in that moment, or we can share a tip report on their behalf to a specific investigative contact. And then with the caller's permission, the police will follow up. And then we refer for cases of abuse and exploitation when a minor is involved, or if the caller has disclosed that they are in immediate danger, or the caller is a danger to themselves and others. So quite a narrow focus there, but I just want to say that when we're talking about referring to police, and I will touch on some of this a little bit later as well. So that key number 1 sort of major finding from our first year of data is that sex and labor trafficking are the most common forms of human trafficking in Canada. The data shows us that 71% of all recorded cases to the hotline were related to sex trafficking, followed by 7% of labor trafficking cases. And then you'll see about 20% of cases were identified as not specified. And that's typically when someone contacts the hotline without specifying the nature of their trafficking situation. And then a really small proportion there of cases, just about 2%, are other. And that includes cases that have identified both sex and labor, or where the situation might have involved other crimes. So the second major trend that we noticed, of course, across all of the cases we found on the hotline, an overwhelming 90% of victims and survivors identify as female. And this finding might be intuitive to some of the people listening today, particularly for social service provider partners. But it's valuable to highlight this because it provides additional statistical evidence that sex trafficking needs to be understood and addressed as a gender-based crime, gender-based violence. And our data also found that it's not just women and girls who are disproportionately targeted by traffickers. The data shows that transgender men, women, and gender non-conforming individuals are being victimized at much higher rates relative to their population size. So this group comprises approximately 0.24% of the total population, but represented 2% of all cases that were documented in year 1. So that means that the victimization rate amongst this particular group is nearly 8 times higher than what you might expect if you were looking at their share of the population. And this finding aligns with other studies that have found that transgender men, women, and gender non-conforming individuals are more susceptible to violent crime. So number 4, you can see the bar, the column at the bottom of the graph, that 32% or 1 in 3 callers identified as being exploited. So that means that the hotline is finding a way to connect and support those who are being most directly impacted by trafficking. And that really means that we're doing our part to fulfill our mandate, and it means that we can really start to get a clear picture of what trafficking is looking like in Canada. The next important piece here is the high proportion of callers who identify as family or friends of a potential victim. And this really speaks to the importance of human trafficking as a community issue and the need for general awareness and education. And then I finally just wanted to point out the bottom there. We see organizations, about 20% or 1 in 5 callers are signalers who are identifying as social service providers. So we know that many of our partners are calling to seek information, or they're looking to coordinate additional services for clients, which is excellent as well. So during the first year of our operations, we made 329 referrals in relation to those 415 trafficking cases that we identified. And what's clear is that navigating service referrals is a very complex process, and that survivors require a really vast array of services. But the ones that were more requested, obviously here is shelter and housing are huge, emergency shelter as well, long-term shelter, counseling, and then case management. And we recognize too that there are significant barriers for accessing social programs. There are different requirements depending on the jurisdiction, and those can be really difficult for folks to navigate. And we really recognize too that a shortage of shelter services, and that's a service that historically has been underfunded and under-resourced, has really impacted survivors' ability to leave dangerous circumstances. So we'll see in a moment that actually COVID-19 has also placed further limitations and pressure on the essential services that survivors need to get access safety. So we found that like I mentioned, 26% of all signalers were family members and friends. And we found that victims and survivors are more likely to share their experiences with someone they know. And this is particularly true for minors. Minors are much more likely to disclose their trafficking to a friend. So for us, this reinforces the need for education and awareness within communities, education awareness for youth particularly, and really reinforcing the importance of community-led responses to trafficking. And then just wanted to touch on the impact of COVID-19. So early on in the pandemic, we recognized that the entire world had been disrupted, and that was obviously going to be true of the social service providers that our callers relied on. So we sent out a survey to all of our partners across Canada just to understand how services had been disrupted. And we found that this shift to remote services had actually placed additional barriers on survivors who were looking to access services, and that the loss of in-person services, particularly counseling, had been really negatively impacted victims and survivors. And we often get asked if we see a correlation between the increase of exploitation and COVID-19. And for a long time, we couldn't see that correlation in our data set. But starting in February 2021 and continuing to present day, we have seen a heightened number of cases coming into the hotline relative to year 1, 2020. And it's possible that a greater awareness of the hotline has led to more people just using it. It's possible that the pandemic is playing a role here. We know that people, although things are opening up, people still tend to be a little bit more isolated. People are spending more time online, especially youth. That makes them more susceptible to luring and grooming by traffickers. So we don't know at this point, we can't pinpoint what is accounting for the higher case levels. But we are hearing from our partners that COVID-19 is having an impact on victimization rates. So I want to touch on another research report that we released in 2021. So this was the Human Trafficking Corridors report. And it really the intention of the report was to look at confirming the existence of routes of exploitation that were being identified and discussed by partners and survivors on the ground across Canada. And the research began with a scan of the available literature and news reports, but ultimately the bulk of the research was done via key informant interviews, which included 20 different law enforcement partners, as well as 49 service provider partners across 38 jurisdictions in Canada. And our research found that there are particular routes being used by traffickers to move victims between various commercial sex markets to one, maximize profit, two, to maximize control over the victim, and three, to evade police detection. And you'll see on the slide here, the red lines indicate the land routes that are being utilized, while the black lines indicate travel via air routes. And then the red dots indicate the larger commercial sex markets that are the destinations along some of those routes or circuits. And we noted in our conversations with the key informants that Ontario and Quebec were the most commonly reported province of origin for survivors. So our research did confirm the existence of those interprovincial corridors, and that's when traffickers are transporting victims across provincial boundaries to access those various commercial markets. Those are largely organized around accessing the most competitive and highest paying markets. Because of the additional operational costs associated with flying or driving, those interprovincial corridors tend to run between large urban centers with fewer stops along the way. But once the traffickers arrive in a new province, they might stay, they may capitalize on that urban center in that city, or they may access other intra-provincial corridors within that province. So the image on this slide is the West Coast circuit that was identified. So that's Quebec through into Alberta. And this was one of the most commonly identified corridors by interviewees, with a noticeable trend in the trafficking of women from Quebec into central and western Canada. I can speculate probably part of that is potentially the language barrier and the enhanced control then that you have once someone is away from their home community. Law enforcement responded specifically noted trafficking victims from Montreal to Calgary by airplane. Victims either travel with their trafficker, they may travel alone, and then they can be met by their trafficker or an associate upon arrival. And then another one of the significant corridors that was identified was the Trans-Canada Highway, with stops in major hubs right across the country. And another kind of piece to add here is that traffickers are often using rental cars, which are being hired in the names of the victims, and they're using short-term accommodations to evade law enforcement as well. You'll see the different types of recruitment here that were identified by the research respondents. And I think what stands out here is that the service providers' responses are noted in red, law enforcement responses are noted in black. And you'll see that both groups were similar in identifying boyfriend traffickers and organized gangs as the two most significant trafficker type. But they also identified a strong interplay between gang-related traffickers and boyfriend-style traffickers. But what's interesting here is many found it difficult to kind of determine whether gang members were using that Romeo trafficking technique to maintain psychological hold on victims, to traffic them as part of the gang's criminal activities, or if it was a case of boyfriend traffickers who are also gang affiliated, but not necessarily trafficking on behalf of their gang. Another point of interest here is that there's a discrepancy between familial trafficking that's being identified by police and service providers. And then the vast majority of respondents describe traffickers as male. And only 40% of law enforcement and 39% of service provider respondents said they had worked with victims and survivors who had been trafficked by other women. And again, female to female recruitment is especially challenging and complex to tease apart, as many times with these types of situations, a young person who was once themselves a victim then becomes a trafficker as a means of survival. so challenging there. So quickly just talk about what are the typologies being identified here by respondents. 90% of law enforcement officers interviewed reported the widespread use of escort services as sort of the primary typology where they were noticing. Other typologies emerged from the interviews, but they weren't identified as using those corridors, and that's most likely because other typologies of trafficking, such as illicit massage and pornography and personal sexual servitude, typically rely on the trafficker to have a stable location for the exploitation to occur, so it wouldn't make sense for them to be using corridors. That women and girls here make up the vast majority of sex trafficking victims and survivors that were identified by frontline agencies, but only a small proportion of law enforcement and service provider respondents had reported previously working with male or trans identified survivors as well. So I just thought that was interesting. And 53% of service provider partners, so pretty much on par with what we're seeing. And 40% of law enforcement respondents indicated that they worked with survivors identifying as Indigenous as well. All right, so I'm going to move into the portion of the presentation where I talk a little bit about the Hotline resource. So what it is, if you're not familiar, it's just for us, we like to say the Hotline is just one tool that we can put in our tool belts when we're looking for ways to address human trafficking. And we also recognize that the Hotline is just one way that people access help. People access help a whole variety of ways. And we like to say there's no wrong door. The Hotline is just one door to access services. But first and foremost, it provides a single memorable number that's accessible anywhere in Canada, day or night. And this is really important because if we think about the corridors research we just talked about, traffickers are moving victims around quite a bit. The Hotline's toll-free, it's confidential, it's multilingual, and it operates independently of government, of immigration, and of police. It can provide a 24/7 coordinated trauma-informed response to social services and police when requested or if required by law. And then finally, the Hotline provides Canada with this really unique opportunity to start to look at some of those high-level learnings on the issue of trafficking that fall outside those official statistics, which we talked about earlier. Our Hotline staff start with 60 hours of person-centered trauma-informed training before they ever pick up the phone call. But training on the Hotline is ongoing around relevant topics and issues. We're able to provide service in over 200 different languages with our translation partner. And we're working in partnership with over 900 organizations and services on the ground as well. So currently there are 4 modes through which you can contact the Hotline. So of course, the toll-free number there, but we also operate chat. You can send us an email and we have a web form. And the Hotline is also accessible to hearing and speech impaired individuals. And those services are available on our website. So who can call the Hotline and really who does call the Hotline? So the Hotline's available to anyone, anywhere seeking assistance, information, or resources. But specifically, we have victims and survivors of all forms of trafficking calling. I've talked about family and friends as well, social service providers, law enforcement, government, frontline service providers, advocates, really anyone looking for additional information and services as well. So what sort of services do we offer? So first and foremost, we can do safety planning with victims who want to leave a trafficking situation. We can provide practical information for them to stay safe. We also work with folks who aren't quite ready to exit and talk them through what a healthy relationship looks like and what an unhealthy relationship looks like. We also do safety planning for families, who want to keep themselves safe and who may have someone in their life who they think is experiencing exploitation. So also working to keep themselves and their loved ones safe. We do provide warm connections to relevant and requested social services in the Hotline's National Referral Directory. Providing emotional support, we're validating the concerns of the caller. The Hotline's able to provide a trauma-informed response by listening without judgment and by believing survivors. We do lots of general information calls about the crime of human trafficking, the resources available, and really explaining the scope and the limitation of the hotline as well. And then we do also discuss the reporting of potential cases and what that might look like for the caller. And our focus is a referral service, and we don't report to police unless requested by the caller or we're mandated, but that is something that people do request when calling into the hotline as well. So when we're thinking about service needs for survivors of trafficking, obviously we want to think about like Maslow's hierarchy of needs, but that there's a hierarchy of service needs that also need to be acknowledged based on each individual circumstance. So safety and security, as well as basic needs, need to be addressed as soon as possible. But survivors also require other complex needs and things like legal services and other emotional support services, as well as case management, which is huge. And that's why we really encourage all of our partners, those 900 service provider partners, as well as our law enforcement partners, to really work closely with the other agencies on the ground to really understand who is able to provide what, so that that case management and that inter-organizational referral can be really smooth. And if you're not sure who to refer into, you can always call the hotline. But really, the hotline has access to over 900 social service provider partners with a variety of program and service offerings across the country. And I will talk a little bit more about the directory in just a minute. So the foundational policies of the hotline, our goal is really to offer options to callers. The hotline is not prescriptive, so we really want the caller to lead the conversation. And ultimately, we want to leave them in a better place at the end of the call than they were before the call. And we endeavor wherever possible to speak to the individual themselves to discuss their situation, discuss their needs, their reporting options, and receive explicit consent to refer them on to services. And we recognize that reporting on behalf of someone without their consent, can lead to increased investigations and immigration proceedings. And that being said, the hotline does not release identifying information about a caller, including to police or service providers. And we will not confirm if an individual has called the hotline unless we're given explicit consent by the caller to do so, unless there are situations where we have a duty to report. All calls are confidential. Notes are not kept verbatim, and callers can always remain anonymous. We also provide callers with a case number. So this is really important, especially for folks who want to remain anonymous, who may be calling back for additional service referrals. This allows them to have their information pulled up quickly, and it reduces the burden on someone to have to retell their story or their situation if they're looking for additional services as well. So talking about creating a safe space, again, that can be a little bit more challenging when you're not in front of someone and they can't read your body language. So the first effective step in effectively responding to any type of hotline call is to build trust with the caller and really create a safe space in which they feel comfortable in communicating their needs. And so some of the things that our hotline response advocates practice while they're on the call is active listening and really like validating concerns of the caller, being transparent about callers' options, managing expectations, talking about next steps, being forthcoming about what the hotline's own limitations are, really explaining why we're asking questions, and again, asking permission before we take any action on behalf of the caller. I should mention here, consent, it doesn't just happen at the beginning of the call. That's an ongoing conversation throughout the life of the call. So consent comes up multiple times during the call. And really working to manage expectations around outcomes for referrals and referrals to law enforcement wherever possible. I sort of touched on some of this already, but again, confidentiality. All communications are confidential, including caller contact information, unless these particular situations are presented. And we'll always inform a caller when we're taking actions on their behalf. or when the caller's consent is needed to share that information with the third party. And like I mentioned, callers can remain completely anonymous. The call is confidential. And oftentimes they are willing to be contacted back by a service provider or law enforcement partner. So in those cases, we would share information. So I want to share a little bit about what you can expect or what a client can expect if they were to call the hotline, because I think it's kind of sometimes a little bit scary, the unknown. So when you initially call into the hotline, all calls are triaged through our phone system. So you can select French or English, and then you're able to press 1 if your case is urgent. And that means that the call will be moved to the front of the queue, while all other calls will be triaged in the order that they came in. And our hotline response advocates begin every call by asking the caller if they are in a safe space to talk. And if they aren't, then our hotline response advocates immediately conduct a safety assessment. From there, we can move into talking about a needs assessment. So really, what are their service needs? What are their concerns? How we can help them. Once the service referral has been, or once appropriate services had been identified, we're able to provide them with options and discuss what their warm referral process might look like. Sometimes callers just want contact information or they want the names of organizations, and we'll provide that too, and then they're able to self-refer, after the fact. I also want to note that we often have times where situations might not necessarily be human trafficking, or maybe there's mental health call. So we're able to refer on to additional helplines that are operating across the country. We're also able to refer callers onto other organizations that are outside the National Referral Directory with not as much knowledge about that service, but we're able to connect people with additional services if required. So just moving on here to talk about the National Referral Directory. So there's 2 ways to access this. So you can call the hotline, like I mentioned, or you can visit the Canadian Human Trafficking Hotline website. So that's kind of a snapshot there of our search engine interface there that's available publicly. And that directory has over 900 partners. And it just is, it's information, it's resources for individuals, organizations, communities, governments. We do obviously have a more comprehensive version of the directory that's available externally that would include law enforcement information, reporting protocols, information about safe houses and how to make referrals, and other private details that have been withheld for the safety of staff and clients. But as you can imagine, this is not static. This is a living thing. So these services and information are in flux all the time. Programs come and go. Unfortunately, service funding comes and goes. So we update this publicly available directory about monthly. And we're currently in the midst of our yearly audit, so that's a significant undertaking. But we're reaching out to all of our partners across Canada currently to make sure that we have the most up-to-date service, and really making sure that we're able to reflect an interesting shift that we've noticed to be able to provide a lot more services virtually as a result of COVID-19, and seeing those stick around now. So that's been interesting for us. But really, when we thought about building this national response to human trafficking, we really realized that having a human trafficking specific directory was foundational to the functioning of the hotline, and the partnerships that we have developed on the ground across Canada are the backbone of the hotline operations, and they're critically important to providing the appropriate timely access to vital services for callers right across Canada. And so we began our work in 2018 by doing extensive mapping of the anti-trafficking service landscape and frontline delivery organizations who are supporting survivors of trafficking. And we began to build the directory and create relationships with community-based partners and agencies. We did a lot of cold calling. We did a lot of explaining who we are and about the hotline. This was before the hotline launched, and really working with our partners to determine how best to refer into their existing services as well. And like I mentioned, we really sort of looked at prioritizing the most requested needs of survivors and sort of chipped away at our list that way. And then looked at geographic considerations. We did that field scan. And then we had a lot of really great conversations. So a lot of our partners are parts of local collaboratives and anti-trafficking networks. So really asking them, like, who do you work with? Who do you refer to? And getting a lot of referrals that way of organizations who to include. But some of the barriers to partnering with community agencies, like overall, I would say over the last 3.5 years, have kind of been around sort of like inconsistent definitions or understanding of trafficking across the field. We have varying levels of trauma-informed training and trauma-informed support. We recognize that there's also a lack of capacity and funding as well. We've noticed that, again, there's a conflation of sex work with human trafficking. There's a bit of unfamiliarity, especially in the early days with the center and the hotline. So some trepidation about what that would mean being part of the directory, and different organizational values and approaches to supporting survivors. But we are really continuing to prioritize shelter and housing. So if you recall that slide around the most requested services, it's an underfunded sector, and it's incredibly requested by our callers. Mental health and counseling is huge, case management, really working with existing sexual assault services and sexual assault centers, looking to add culturally competent services to our directory, newcomer and settlement services, transportation is huge, helping people get between services is huge, legal aid as well as youth supports. And then just a breakdown of what currently, so this is numbers from this week, I had them pulled. So we have 924 service delivery partners, which looks at about 3,700 unique services and programs available to callers across Canada. And if we want to break that down a little bit more, that means that 52% of our partners have human trafficking specific training that they've shared with us, or shared that they have done with us. Approximately 10% of that referral directory has partners who are able to provide culturally relevant care to Indigenous persons. Only 6% of our partners list human trafficking as their main focus area, and 20% of partners offer HT-specific services or programs. So many of our partners work in allied service areas such as domestic violence or sexualized violence. And really, we recognize that in a perfect world, we would always want to refer callers to services and supports that are specifically tailored for their experience and to serve that population, and that are trauma informed, that they're person centered. But unfortunately, we live in an imperfect world. So it's really incredible to see our partners kind of come together and help us fill those gaps and really make sure that we're starting to close those gaps for survivors as well. Very quickly, some of the more broad service gaps that we're seeing across the country. I think I mentioned this earlier, but dedicated HT services for male identifying individuals, services that really look at that intersectionality between trafficking and being a member of the 2S LGBTQI+ community, labor trafficking, services for labor trafficking survivors, and then other forms of trafficking. So I think when we break down our human trafficking specific programs, 3/4 are for sex trafficking, will serve sex trafficking survivors, and only 1/4 have capacity to serve sex and labor. So really a real kind of distinction between what services are available to those two populations. And we'd like to see a better balance of those two. And then some service gaps, again, transportation, I mentioned, debt forgiveness. We'd love to see more peer survivor-led supports. And then really, we're seeing lots of crisis and emergency services, which are absolutely critical, but really also thinking about how we continue to fund programs and services that provide long-term supports for survivors of trafficking. So what does receiving a referral from the hotline look like? So again, accessing that National Referral Directory 24/7. Referrals are searched based on the person's location, their service needs, and then the eligibility of that service as well. So what is the eligibility criteria for that program? We provide warm transfers and then obviously provide supports to victims and families. And then we do warm transfers where we're connecting the caller directly with the service provider. We can call the service provider and leave a voicemail with contact information when that's provided by the caller. And like I mentioned, callers can self-refer if they choose. And then the last part of the presentation today, because I know I have a few minutes left here before we move into Q&A, but I did want to talk about connecting callers to law enforcement, because I think folks have a lot of trepidation and questions around what that looks like. So since the launch of the hotline, we've worked with police across Canada to develop localized referral and reporting protocols. And that's with about 100 law enforcement agencies, including municipal police, provincial, First Nations, and federal policing services. And that's really to ensure that emergency calls, urgent situations can be triaged appropriately when requested, and that we're sharing information with the appropriate point of contact. And those decisions to report, like I mentioned, are made on a case-by-case basis. So those 100 police agencies, which means we have about 196 referral and reporting protocols with police. And we have noticed that some of the gaps in terms of participating in the National Referral Directory are for more rural police agencies. And, you know, quite frankly, there is still a knowledge gap around trafficking for police. And we know that police aren't experts in victim management. So really encouraging and advocating for them to work collaboratively with community-based agencies who can provide that immediate critical response to help stabilize a victim of crime is really important. But at the last glance, sort of looking at our directory overall, I would say about 30% of our HT partners have specialization or training to support a survivor of trafficking. The majority of our law enforcement partners, or our points of contact, I should say, typically belong to general investigative units. So they work with a street crime unit or a major crime or a sex crime unit. So there's certainly like a level of training and expertise that is required to investigate human trafficking occurrences. They're complex, they're incredibly nuanced. And we're also seeing that the role of technology continues to mean that police and other justice professionals are having to adapt and evolve. Well, similar to social service providers, they're feeling very under-resourced to address this crime as well. Very quickly, talking about those referral and reporting protocols. So the purpose of those, again, is really to provide a clear triage response to live calls and cases day or night. The hotline has the ability to connect callers directly to 911 dispatch centers in Canada, in the US, if they wish. And it is just another way that people access help. So, you know, people can call police directly. They can walk through the doors of a social service agency or a police service agency themselves, and we can help make that referral on their behalf as well. And then really quickly, what types of cases are not referred on to police? I think we get asked this sometimes too. So situations where there is insufficient evidence of human trafficking indicators. And again, the hotline isn't a tip line. Our mandate is to serve human trafficking victims and survivors and report HT crimes when appropriate. So if it's a non-trafficking situation, we can talk to the caller and we can discuss their reporting options. We can talk to them about reporting to police directly if that's what they want to do. We can talk to them about reporting a tip through Crime Stoppers, or reporting to an appropriate government agency as well. And really, you know, explain to the caller that we do need enough information about the situation to actually share that information with police as well. So when we have a lack of reportable or identifying details about the situation, you know, we may elect not to refer that on to police. Again, this is why we really prioritize a victim-centered approach or a person-centered approach. And it's really important for us to consider how reporting a tip might impact a victim or survivor. And we recognize that, calls to police can increase surveillance and investigations. So whenever possible, we endeavor to speak with a potential victim directly to ensure that we are not causing unintended harm. We don't refer anything if that has already been referred on to police, with the exception of minors. Again, we don't want to kind of have two parallel investigations started. That's not a good use of anyone's time and resource. We would never refer unless the caller is asking directly to be contacted by police or is comfortable being referred on to law enforcement. And then, of course, the majority of our callers are seeking service referrals only and are not interested in being connected with police. So we would not do so in that sense. And then again, just talking about what the hotline is not. So we're not an investigative body, and we will not interfere with any police operations. We don't seek to replace any operating hotlines or helplines in Canada, or any other hotlines that are servicing human trafficking survivors either. We'll never deter individuals from calling a frontline support agency directly, or police if they wish to do so. And the hotline is really focused on providing really excellent referrals. So we're not a counseling line. We do lots of emotional support work, but we do refer folks onto appropriate counseling services. We have really great resources that are free. They're downloadable on our website. So they include the hotline number. We've got posters and postcards there with some general indicators. And we always just think the more places that the hotline is posted, the better. I think the more people that see that number, that means we have a better chance of reaching the folks who need that assistance. We've recently also translated our posters into Ukrainian. So if there are any frontline agencies tuning in today who might be working with newcomers, who may be at an increased risk for exploitation because of being displaced, those posters are available on our website, and then the postcards with the indicators translated into Ukrainian can be accessed by emailing us directly. And I will put that at the last slide, but feel free to reach out if you want access to those as well. And I like those wallet cards as well. I think if it's appropriate, if you're doing outreach or you're having folks come into the office, and it's safe to do so, those wallet cards are always really good to leave with people who might be at risk, or who might be in a trafficking situation. They might not be ready to leave. And again, I caveat by saying that if it's appropriate and safe to hand that number off as well. We've also translated our materials into 17 of the most populous Indigenous languages in Canada, and we can provide our hotline teleservice in 27 different Indigenous languages as well. So those are available for download on our website. And then last but not least, we always kind of want to finish with a takeaway. So what can you do to help or be part of the anti-trafficking movement? So first and foremost, I think education is key. It's the key to addressing this issue. It's the key to prevention. We really want folks to learn what those red flag indicators of grooming and luring are, and really understand who is most at risk for being targeted for trafficking. We really want community members to learn, share, and post the Canadian Human Trafficking Hotline number. If you're a social service provider and your organization is not yet a member, but you think it might be a good fit, consider joining the National Referral Directory to assist us in supporting survivors of trafficking. Again, if you're a social service provider, think about joining or starting an anti-trafficking service provider network to really help strengthen the local safety net on the ground in your community, and then help create and define new pathways to service for survivors of trafficking. And that is our contact information there at the bottom. So if you had any additional questions, if you're feeling shy, or if you want additional resources, any of the research reports I mentioned today in my presentation are available on our website, but I'm happy to send them directly as well. And if you're interested in being a member of the National Referral Directory, you can also email us there at partnership@ccteht.ca.
Lovely. Thank you so much, Ashley. So again, I would just like to indicate to everyone, if you do have a question for Ashley, you can leave one in the Q&A box just at the bottom of your screen, or if that doesn't fulfill your needs, you can just message a direct message any of the members that have moderator in their name, and we can ask the question to Ashley anonymously for you as well. So thank you so much, Ashley. We do have some questions that were sent to us, and we hope that we can get to most of them before we get started today. So I do have a question. You mentioned that Quebec and Ontario are the main provinces of origin for human trafficking. And so I do wonder, with what we're seeing is kind of like an influx of some refugee situations across the globe. Has the center seen any connections between refugee crises and kind of the need for immigration and moving to like a safe place internationally, and then potentially coming to Canada, connecting to higher instances of human trafficking?
Great question. I think it's too early to say, and I'll just like be really honest. I don't have access to hotline level data or case information, so I can't actually speak to that. We know that the UN has identified that women and children leaving Ukraine are at an elevated risk for being exploited. And we're also recognizing that the rush to sort of have them moved out of a difficult situation and into Canada means that some of those traditional processes for immigration have been fast tracked. So people are arriving without basic needs, without ID, without work permits. These are the things systemically that make people very vulnerable to being exploited. Well, I don't know personally if those cases are happening. I think we have a situation where we have all the perfect elements for that to happen. I do want to say that, displacement through war or famine, those are things that really make people more at risk because you're away from your home community, you're away from your supports. But something that I think is really interesting that we've been having conversations about and thinking about in like 5 to 10 years is what is going to be the impact of climate change on displaced people, right? And how does climate change actually is going to start impacting human trafficking rates globally? There's not a lot being done on that level and looking at that interconnection yet, but I think maybe 5 to 10 years, we're going to start to see the emergence of this issue as well, looking at how, whether it's high temperatures or drought or famine related to the climate is starting to displace people and really making them more at risk for being trafficked. So I don't know if that answers your question, but we did see that this was a potential for trafficking exploitation with the influx of newcomers. And so we responded by adding those Ukrainian resources that we didn't have 2 months ago.
Wow, no, I think that's profound in the sense of like, again, how actually it's systems and institutions and those multi-layered impacts, instead of it's maybe easier to kind of cognitively like human trafficking exists in this one particular instance and context, but it's actually like layered. So I think that's incredibly profound to add that other piece of nuance to this conversation of just sort of like, okay, we recognize human trafficking, and now we add another sort of crisis type of situation, and what is the impact to be very aware of. Thank you. I think that also relates to a question that we have in the chat box as well, that idea of also kind of people being pushed out and displaced because of their identity. And so Karen was asking, why are transgender and gender nonconforming folks more susceptible to violent crime, or specifically targeted disproportionately by sex traffickers? And she kind of goes on to say, like, hypothetically, if there's the same percentage of transgender, gender nonconforming folks in society as cisgender women and girls, do you think that there would also be a higher percentage of transgender or gender nonconforming folks being trafficked?
Okay, I'll try and answer the first part of that. Thanks,
Okay.
Karen. Karen for the question.
Yes, yeah.
So I think that folks from the LGBTQ plus, I forgot some acronyms there, but are still facing so much stigma in communities, right? within their own homes, their own families, their own communities. And so they are sometimes pushed out. They're sometimes pushed out of their own communities or their home family networks. So they're creating their own communities. And sometimes that means they're leaving home communities, looking for safety elsewhere. And that puts people at risk. Anytime, like we just mentioned, anytime we're being displaced away from even sometimes unsafe homes and communities, we actually open the doors to a whole host of other unsafe circumstances or people, right? And so we know that homeless youth are particularly at risk for being trafficked. And then when you layer, like we're talking about intersectionality, when you layer being identified or being part of a sexual or gender minority group, there's that additional layer of risk there. And then we're realizing that there's really is not enough services that are programmed, that are tailored to this particular population. So there's lots of sex trafficking services available. I shouldn't say lots. There are plenty of sex trafficking services and support services available, but are there a lot of services that are able to reflect that experience? So are those service providers able to reflect that experience? Are they able to layer those different intersectionalities and provide that service? I don't think so, right? We're seeing a real gap in that service. So I think for those reasons, folks are just more at risk. And, you know, traffickers are extremely, extremely skilled at really kind of like sizing people up, getting to know them, paying special attention, talking about your life. And it can seem innocent, but they're really trying to like pick away and trying to find what those, like, I hate to use the word vulnerability because it's not a vulnerability, but they're really trying to look at what are those factors that is making someone at risk. So are there, is there something going on in their home life? Are they struggling with low self-esteem? Traffickers are picking up on this, but doing it in a way that's really casual. So maybe they're seeing a teen who's struggling with their sexual identity and is feeling really kind of removed from their family environment and is looking for belonging somewhere else. And the trafficker will step in and they'll see that and they'll provide that belonging, and really kind of, they're preying on that, right? They're preying on that vulnerability or that whatever that person's struggling with. And sorry, Christina, could you repeat the second part of Karen's question?
Yeah, it was really interconnected. And I think you kind of answered it in your flow too, about like this particular like vulnerability piece, because I mean, in reality, all of us like can become or can interact with someone who is intentionally looking to manipulate a situation or us. And all of us as human beings, it's part of our nature and human condition of just want to be validated, loved, and supported. And, we can make friendships all the time with people who like, oh, they get it, they understand me. But with these particular people who are looking to exploit intentionally, it's for a more malicious purpose and not to get to know you and to provide that love and support. It's then to also then turn that in a way that they can profit off of the exploitation. So realistically, we all have vulnerabilities. We all go through stuff and kind of want to be loved and supported and accepted for who we are. And it's just, then there's people out there that choose to manipulate that.
Yeah, and I think there's a real push to kind of, and I kind of hesitated when I use that word vulnerabilities, because I think that puts the onus on the victim or the survivor. But we really want to put the onus back on the institutions and the structures in our society that perpetuate that, right? So what are the structures in our society that then are making someone more likely to be targeted, right? That takes the onus off the individual. It puts it back on the institutions and the structures and the colonialism and the racism and the poverty, but it also puts the magnifying glass back on the trafficker, right? So it's not what's I have stable inside me that made me more likely to be trafficked. It's what's happening around me that someone else is picking up on and using to weaponize.
That's they're choosing to weaponize. Wow, I think that's incredibly profound. Thank you for that. And so, I mean, now that we're talking about like systems, I mean, in your opinion, or in the center's opinion, whichever you choose to kind of answer by, but what are some radical steps that systems or communities can take to address and kind of, the end goal being obviously to eradicate, so this isn't an experience anyone goes through, but to address, and particularly that sexual exploitation and sexual trafficking? Like, what, if we're speaking, let's get radical. What are some
Yeah,
things that
let's
you
get
think?
crazy.
Yeah.
Okay, so I'm going to speak as myself, Ashley, and not as the center. But I think we've seen in the last 2.5 this real movement around, and like, plug your ears if this might be offensive, but and I, again, speaking as Ashley, the idea around defunding police, and I think if we're reframing that conversation to say, we're going to actually reallocate a percentage of policing budgets, because we know that police typically are really bad at victim management and victim support. And we're really going to take that money and those resources, and we're going to reinvest them into community responses. That's where callers are asking to be connected. Let's be honest, callers calling the Canadian Human Trafficking Hotline are very rarely wanting to be connected to police, right? It's an institution, it's an extension of a colonial government. They want social services, and we need to do better to support, expand, enhance, train, fund the social service and that safety net. And police are a part of it, but we're seeing more and more that the choice is to move away from that. And so, yes, there's lots of work that the justice system needs to do, and I mentioned that in my challenges for Canada slide, but I think if we're thinking like very radically, let's think about community-based responses, because that's what survivors are telling us they want. And then second, I think we also need to think about shifting our thinking. So responses to trafficking right now are very much, we're just responding to trafficking, right? We're not really focused on prevention. And so I think when we're talking about this, I see some really interesting, promising practices around public health approaches, and really thinking about upstream measures and really focusing on prevention versus reaction. And a lot of what we're doing is reacting, right? So how do we really focus and harness all of that energy into prevention? And that, to me, is going to come through education. And it seems really simple, but it's very complex. How do we get this information out to young people? How do we ensure that we're having conversations about healthy relationships and boundaries, so that young people are starting to recognize earlier on in that grooming and luring process, hey, something isn't right here. My gut is telling me heck no, right? And then we're also doing that education with those who are more likely to be the perpetrators, to say, like, to do that education piece too. So I think, like, prevention, reaction, that's what we're doing. It's great, but we also need to really focus on prevention. Those
That's
would be
great.
my two
Yeah.
radical shifts.
Yeah, it's treat the cause, not the symptom, kind of thing, which we always sort of get back to. And you did mention even the healthcare system, medical system too. And kind of as you were presenting, we were kind of having a chat too about how even in all of the different sort of steps along the reporting process, or even just response process to whether it's an incident of exploitation or sexual violence, I mean, even those different steps of having a survivor have to constantly repeat their story over and over again, and kind of not have anyone listen to what they're saying or listen to what they're explaining their needs to be, and saying, this is what you sometimes need, or like continue on in order to go through this process. And so when you speak about creating like a larger safety net as well, I mean, as individual people too, for supporting folks in our lives who may be going through this type of situation and we just haven't recognized it as such. I mean, what is one thing that we can do as just a community member, as a friend, family member, to better respond to a survivor if they are disclosing, or just to open ourselves up as a safe person to just, like, I'm here if you need to have a chat?
Yeah, that's a good question. I think we talk about stigma a lot, and the fear of the unknown, and what that means to disclose. And that's just to I think, I'm not a survivor, but I can imagine that's the biggest hurdle, right? Is just to disclose to someone. And so really making sure that we're having non-judgmental conversations, that we're keeping the door open, that we're continuing to have the conversation, right? So that we're continuing to create those safe spaces to have those conversations, but also recognizing that like if folks aren't ready to disclose, that's okay too. And like I mentioned, I think one of the best things to do is to share that hotline number so that if folks do have questions about their situation, like I said, people don't actually really realize that they're being exploited when they're being exploited. And sometimes it's better to have a neutral third party, right? There's no emotion there. It's not a family member, it's not a friend. So we can talk through the situation and provide that safety planning. And if it's safe to do so, share the hotline number, or other local social services where someone can access that non-judgmental support, I think would be a great place to start.
No, that's a really good point about, yeah, sometimes be able to create distance to someone who can just listen and give you the support that you need and not have to worry about whether you're traumatizing the person you're trying to disclose to, for sure. There's another question here too about wondering about the percentage of sexually exploited and trafficked children. And then kind of if we can think of that like under 18 and youth, because things get weird in our conceptualization of youth, and especially when you're considered sexually mature and what that can kind of look like. And so
Yeah.
they sort of asked with that children and youth piece, like what the most common way that they're signaled by like traffickers and to kind of like get connected. And then is there a similar context with which children are being sexually trafficked and used or bought by sex buyers in Canada, as we're sort of seeing, or that we can kind of go to our default of this happens in particular places in the world?
Okay, there's a lot of questions in that question.
Yes.
So based on the data from StatsCan, because I can't speak to hotline level data on the incidence of minor domestic sex trafficking, but I believe that StatsCan says that I think it's like 20, so a quarter of all trafficking cases involve individuals under the age of 18.
Wow.
So that's police reported data. I want to caveat that by saying that can be skewed because I know from my experience, a lot of police services are so under-resourced that they are typically just focusing on looking at ads for potential trafficking victims who look underage, right? So they're looking for all the indicators. They're doing proactive work, obviously responding to cases that come to them, but the proactive stuff is really, there's so much out there, they're really focusing more on minors. So that data, again, the StatsCan data can be skewed because it is police reported data. Absolutely, I think youth are being groomed and lured and trafficked. You know, there's conversations about demand for sure. I don't think they're the only group, but I think that, yeah, 25% based on police reported data are under the age of 18. And yeah, we get into that kind of sticky situation where like 16 to 18, and depending on the province, we have different rules around reporting requirements, but youth are smart. So youth who have been involved in the justice system or in the child welfare system, they're smart. They're calling, they're accessing services, and they're not disclosing, like I mentioned in my presentation. That's okay. But they're not identifying as being a youth, or they're not identifying as being underage because they know that that triggers mandatory reporting. So they're clever and they're going to access help the way that they want to. So again, I think it's also on us to build that rapport and build those relationships and offer those services and be available so that you can build that relationship, and then when they're ready to, they can disclose, and then you can provide them that service. I don't know what the other questions layered in there were, but hopefully I answered that. We are really thoughtful and put a lot of time into looking at our own data and recognizing ethical practices around data sharing. And so that's why our year one data release was very high level trends, because just reporting on specific data, and if it's not anonymized and it's not aggregated, can actually put people at an additional risk. So very high level, really thinking about broader trends to help inform and shine a light, but Really where the interesting and the more nuanced pieces is going to come out for us as an organization is starting to do that primary research. So we have the Indigenous community studies. We hope when that's successful that we can start to work and do a similar study with Black communities as well in Canada to really look at how trafficking is impacting those communities. But also there are other organizations who work specifically with youth who probably have a better handle on what trafficking looks like for their population. So I'm thinking like folks like Covenant House in Toronto specifically focus on youth homelessness. So really able to kind of look at the intersectionality between being homeless or underhoused and how that's impacting or making someone more at risk for being trafficked. So I would definitely reach out to them if you have specific questions around minor domestic sex trafficking.
No, that's a great answer and a great resource as well. I appreciate that. Thank you. And also the notes of youth are smart. I'm like, I do think we sometimes infantilize youth, and it's just like, yeah, they can think that we're old and we don't know anything as adults. But yes, they've been navigating situations and have very clever ways in which to, create levels of protection even when they're experiencing circumstances like unsecure housing arrangements and things like that. Yes. So yeah, totally. Let's give the youth the credit here too, definitely. And so the last, it's kind of a comment, like less of a question. And so you spoke about the climate crisis. And so someone wanted to comment that climate change can be a threat multiplier, especially for Indigenous and other groups that are often set up in circumstances to be made vulnerable or experience oppression. And especially now as we're starting to see evacuated individuals from fires, from flooding into different host communities, and that sort of displacement fueled by climate change is 100% amplifying risk factors for trafficking, for exploitation. And so part of the question too is, in the center, in your understanding, are there sort of ways in which those gray areas of human trafficking, where it starts as a situation of sort of displacement or couch surfing, and then, accommodation, then a landlord starts to hint at sort of, and set other forms of payment. So such as exploitive sex work or underpaid or unpaid free work. And then it starts to kind of evolve, like there's many forms of exploitation and many forms of trafficking of people that it can evolve into a more defined, the more aligned closer to the definition of human trafficking. So do you have any comments too about kind of the center's view of how this exploitation kind of can evolve into these different forms?
Yeah, thank you so much for that comment. And I think you're right. When we're thinking about climate change, we don't have to actually look outside of Canada's borders or outside of Turtle Island. We can see that there are going to be folks in this country who maybe have an ice road into their community, that as temperatures increase, that ice road is not going to be firm as long through the year. And we're thinking about food insecurity and inflation, and communities in the north that rely on the environment and the animals to sustain themselves, right? So there are absolutely going to be Indigenous communities who are going to face displacement, and we already know that Indigenous folks who are leaving home communities into urban centers are just more at risk of being targeted for trafficking, right? For all of those systemic reasons I mentioned. So yeah, I do want to acknowledge that is a reality. And I think we need to put a little bit more focus on that and really look at kind of the emergence of the climate crisis, layering in human trafficking, because I don't think we're really talking about those two that much. In terms of coming into urban centers, I think that like couch surfing is that like hidden homelessness. So when we're looking at homeless data, I think that women are typically more likely to be not captured in official statistics around homelessness because they have more informal arrangements. So maybe they are couch surfing, maybe they're staying with a friend or a relative. So they are a significant portion of those who are experiencing homeless, but they're not necessarily be captured in our data, which means that then the services aren't being tailored to that population who really need it. But to say that, yes, those are the types of arrangements, informal, casual arrangements, that really do make people more at risk. And I don't think it's just one particular group. I can think if, it's a transgender teenager who is leaving home and coming to a city to find that community. And maybe they meet someone and that person offers them a couch to sleep on. And then, there are maybe potentially being propositioned, or after a little while, it's like, okay, now you need to pay for the roof over your head and the food that I've been giving you. So that absolutely does happen. Again, I can't speak to like case level data, what we're hearing on the hotline, but yeah, absolutely, that is an experience. And that's a way that trafficking can perpetuate.
No, I thank you for sharing that insight too. And again, that like informal, I mean, that all of us should be aware, if we're professionals who are engaged in this work too, is, numbers can only mean so much, because if we're not actually able to see all of those different intersections, and again, where it's the predominant folks who have those informal relationships that don't get captured, again, we go back to women, girls, non-binary and trans folks,
Yes.
as well. And then we add all of those layers. So I really, really appreciate that. So thank you, Ashley, so much for your presentation today. And just so everyone knows, we did drop links to the many different reports that the Canadian Centre to End Human Trafficking in the chat box as well, for individuals to revisit, and we'll ensure that once we complete this recording, that we will also have all of those resources for participants to visit again later. So again, thank you, Ashley. Thank you to everyone for attending this session this afternoon. I want to appreciate and pay special attention to you, Ashley, as well as the Canadian Centre to End Human Trafficking, the work and the commitment that your organization has made to end sexual exploitation and human trafficking in all of its forms across this country. So I appreciate that and send my many thanks and gratitude towards you. And I just want to say that everyone's attendance in this session here today demonstrates, again, that together we can make a difference, right? We're here, we're engaging in these conversations, and that we can end sexual exploitation. We can become a province, become a country where everyone is free from this threat or experience of sexual exploitation and sexual violence. So I want to thank everyone for attending here today. And tomorrow morning at 10 a.m., we do have a session about ambiguous loss and being able to learn the tools to support folks who have maybe lost family members due to human trafficking situations and they're no longer in contact, or just have folks that are missing and not sure where they are and how we can best provide support to that. So you can register for that event at our website, svaw2022.ca. Thanks again, Ashley, and thank you everyone for attending today.